which a clavicle belongs can be determined from the following characters. The lateral end is flat and the medial end is large and quadrilateral. The shaft is slightly curved so that it is convex forwards in its medial 2/3 and concave forwards in its lateral 1/3. The inferior surface is grooved longitudinally in its middle 1/3. The shaft is divisible into the lateral 1/3 and the medial 2/3. The lateral 1/3 of the shaft is flattened from above downwards. It has two borders, anterior and posterior. The anterior border is concave forwards. The posterior border is convex backwards. This part of the bone has two surfaces, superior and inferior. The superior surface is subcutaneous and the inferior surface presents an elevation called the conoid tubercle and a ridge called the trapezoid ridge. The medial 2/3 of the shaft is rounded and is said to have four surfaces. The anterior surface is convex forwards. The posterior surface is smooth. The superior surface is rough in its medial part. The inferior surface has a rough oval impression at the medial end. The lateral half of this surface has a longitudinal subclavian groove. The nutrient foramen lies at the lateral end of the groove. The lateral or the acromial end is flattened from above downwards. It bears a facet that articulates with the acromion process of the scapula to form the acromioclavicular joint. The medial or the sternal end is quadrangular and articulates with the clavicular notch of the manubrium sterni to form the sternoclavicular joint. The articular surface extends to the inferior aspect for articulation with the first costal cartilage. At the lateral end, the margin of the articular surface for its acromioclavicular joint gives attachment to the joint capsule. At the medial end, the margin of the articular surface for the sternum gives attachment to fibrous capsule of sternoclavicular joint all round, articular disc posterior-superiorly, interclavicular ligament superiorly, lateral 1/3 of the shaft. The anterior border gives origin to the deltoid. The posterior border provides insertion to the trapezius. The conoid tubercle and the trapezoid ridge give attachment to the conoid and trapezoid parts of the coracoclavicular ligament. Medial 2/3 of the shaft. Most of the anterior surface gives origin to the pectoralis major. Half of the rough superior surface gives origin to the clavicular head of the sternocleidomastoid. The oval impression on the inferior surface at the medial end gives attachment to the costoclavicular ligament. The subclavian groove gives insertion to the subclavius muscle. The margins of the groove give attachment to the clavipectoral fascia. The posterior surface close to the medial end gives origin to the sternohyoid muscle. The subclavian vessels and cords of the brachial plexus pass towards the axilla lying between the inferior surface of the clavicle and upper surface of the first rib. Subclavius muscle acts as a cushion. The nutrient foramen transmits a branch of the suprascapular artery.